Hello everyone, my name is Vivek Iyer. I am Assistant Professor of Medicine in the Division of Pulmonary and Critical Care Medicine at Mayo. Thank you for your interest in this article. So the title of our paper is The Impact of Center Volumes on Outcomes in Patients with HHT. As an introduction, I want to first introduce HHT. Now, many of you know about this disease. It is Hereditary Hemorrhagic Telangiectasia. The older name, or the other name for this, is Osler-Weber-Rendu or Weber-Rendu disease. This is basically an autosomal dominant disease that affects angiogenesis in many different vascular beds. Patients typically tend to get telangiectasias, and the most common place where you can see this is skin and mucous membrane. So you can almost see an HHT patient see telangiectasias on the lip, tongue, the inside of their nose, and can diagnose this along with another cardinal symptom, which is nosebleeds. Almost everyone will have a first generation family member with the same disease, with HHT. So this is passed on generation to generation, autosomal dominant. And because these telangiectasias can also happen in visceral organs, they can happen in the brain, in the lung, in the liver, and other internal organs, and can really be associated with some pretty serious and devastating complications. My interest, passion, and love is HHT, a disease that is rare, that you may have encountered in your practice, and something we deal with quite often here at Mayo because we are an HHT, one of the HHT centers of excellence around the country, and we follow a lot of patients with this rare disease. What we found is that HHT patients treated at high volume centers that see the top 25 percentile in terms of volume across the country, patients treated at those centers, high volume centers, tend to have better outcomes. And that includes lower mortality at the highest volume centers, lower hospital lengths of stay, lower iatrogenic complication rates, and this is in spite of the fact that patients treated at these centers are actually sicker than patients treated at low volume centers. Now, why is this even important? We know that physicians and healthcare providers have not much exposure to HHT during their training. Many physicians and healthcare providers go through their entire training, med school, and may have come across HHT once. So the idea was to show that that places that deal with this every day, that have built up expertise in dealing with this, maybe they do a better job at this, and that's what we found. What we used was something called the NIS, which is the Nationwide Inpatient Survey. So this is a large collection of hospital discharges across the country, selected in a random fashion, and we pooled more than 9,000 patients with HHT and analyzed them based on where they were discharged from, either from high volume centers or low volume centers. And so the conclusions of the study were that high volume centers appear to do a better job at dealing with high risk complicated HHT patients, and they do them with lower rates of complications, lower hospital lengths of stay, and also have better outcomes. I really think that HHT is a disease that requires and deserves more attention, training, exposure through through someone's training, and this can definitely be improved upon. The Cure HHT Foundation actually has a growing network of HHT centers of excellence across the country. So hopefully these centers will serve as resources for patients, serve as centers of expertise, and can really provide high value and good care to these patients. And these patients really can be quite sick and have a number of complications that are quite unique to their disease. And I do wish to thank everyone who's helped me through this, especially all my co-authors, my mentor and friend, Dr. Karen Swanson, Dr. Brinjikji, whose expertise with the NIS database is unparalleled, and all my other co-authors. So thank you again for your interest in this article. This is one of many that we will be publishing on from the NIS database, and thank you for your interest in HHT.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.